A very good afternoon. You're watching India Today with me, Nabila Jamal. I'm right here in Karnataka, Mandya district. This is about a few hours away from Karnataka, in Bengaluru rather, where we're seeing a surge in cases. We do know that district areas are now reporting a high in COVID-19 daily cases. But before that, I'm going to take you through this story here where Karnataka people are currently running pillar to post to find beds. It seems at a time like this, the Karnataka Health Minister K. Sudhakar has raked up a controversy. The Karnataka Health Minister there has reserved 15% of beds in 3 Bengaluru hospitals only for the people of his home constituency, which is Aster CMI Hospital, Baptist Hospital and Columbia Asia. These are the hospitals where a reservation has been made for people of Chikbalapura constituency, which is the home constituency of the health minister. Now, the BBMP staff who are interacting with patients through their war room numbers, many patients are being told that beds are not available and they'll have to wait a little longer for beds. But in reality, about 15% of the beds at these hospitals itself are left vacant in accordance with the health minister's order. Now, defending the decision here, Sudhakar, the health minister, says that Chikbalapur, his home constituency, does not have enough medical infrastructure. There's no medical college and there's poor health infrastructure there, and therefore he's entitled to reserve about 100 beds there for the people of his constituency. You have the Congress MLA Krishna Baregada, in whose constituency these 3 hospitals belong. He slammed the health minister, saying that he's ignoring the larger population only for the interest of his constituency people. Let's take a listen.
ಜಿಲ್ಲೆಗೆ ಇವತ್ತು ಯಾವುದೇ ಒಂದು ವೈದ್ಯಕೀಯ ಕಾಲೇಜ್ ಇಲ್ಲ, ತೃತೀಯ ಹಂತದ ಚಿಕಿತ್ಸೆ ಸೌಲಭ್ಯ ಇಲ್ಲ. ಏನು ಮಾನ್ಯ ಸುಧಾಕರ್ ಅವರು ಹೆಲ್ತ್ ಮಿನಿಸ್ಟರ್ ಆಗಿರೋದಕ್ಕೆ ಚಿಕ್ಕಬಳ್ಳಾಪುರ ಜನರು ಸಂಕಷ್ಟಕ್ಕೆ ಈಡಾಗ್ಬೇಕಾ? ಒಂದು ಆಸ್ಪತ್ರೆಯನ್ನ ರಿಸರ್ವ್ ಮಾಡಿ ಇಲ್ಲಿ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಒಂದೇ ಆಸ್ಪತ್ರೆ, ಅದು ಎಷ್ಟು 100 ಹಾಸಿಗೆ. ಆದ್ರೆ ನಾಟ್ ಎಂಟೈಟಲ್, ಚಿಕ್ಕಬಳ್ಳಾಪುರ ಜಿಲ್ಲೆಯವರು ಎಂಟೈಟಲ್ ಆಗಿಲ್ವಾ ಚಿಕಿತ್ಸೆ ಸಿಗ್ಬೇಕು ಅಂತೇಳಿ?
We heard the justification from him is that Chikbalapur does not have sufficient medical infrastructure and therefore he has to look out for his people as well.
The whole of India doesn't have sufficient medical infrastructure. That doesn't mean that you build forts around a few available facilities and try to hijack them for yourself. You have to make sure every deserving patient, whether he or she is in Chikbalapur or in Tumkur or in Bangalore or in Kolar, anywhere a deserving patient must get. The solution is not to block off facilities, is not to exclusively reserve any facility for anybody.
Right.
It is to make sure that every deserving patient gets it.
I wanted to shift one of my cousin brother to the hospital. The BBMP said that there is no bed available right now, sir. In case if anything comes up, we will call you. And they also mentioned that there are people who have been waiting with the oxygen level of 60-65, and even they have not got bed yet. So even they are waiting for the bed. 100 times I would have called BBMP to check with the availability of bed, and the answer was the same.
Now, at a time when inter-district travel is not allowed owing to the COVID surge in Karnataka, we see that B.S. Yadurappa's son, B.Y. Vijendras, seems to have got some preferential treatment. As per what we saw here, Vijendra was seen travelling all the way from Bengaluru to Mysuru to visit a temple during the lockdown. Despite places of worship being shut due to recent corona surge, Chief Minister B.S. Yadurappa's son and BJP Vice President B.Y. Vijendra received VVIP treatment on his temple visit there at the Shrikanteshwara temple in Mysuru's Nanjangud. Now, while inter-district travel is allowed only for emergency purposes, Vijendra's temple visit is now come as a mockery of the lockdown imposed by his own father's administration, with the state reporting more than 30,000 cases in just the last 24 hours. In fact, the Congress party lambasted the ruling party for the incident, pointing out that there can be no exceptions here during the pandemic. On the other hand, Deputy Chief Minister Lakshman Savadi has defended the actions of the Chief Minister's son, saying that B.Y. Vijendra visited Mysuru to pray to the God for protecting the people of Karnataka against COVID-19.
Under special permission, how come DC can give an authority
to open the temple and make puja. This is our question. We need to get the reply from Deputy Commissioner of Mysore district. Rule has to be same for everyone. There should not be two different rules. One is for politicians, other one is for VIPs, and third one is for general public. Even I am interested in going to temple. Can I have such a special permission from authority? So this is not correct. The violation of the code is being done by their own people.
वो कोरोना का बारे के में भगवान को मांग रहे हैं, कोरोना जल्दी से जल्दी यहाँ से निकल जाइए, इसलिए भगवान को प्रार्थना करने के लिए सीएम साहब का बेटा उधर गया था, वो अच्छा काम किया। सामाजिक कड़कड़े रहकर वो पार्टी का उपाध्यक्ष है, इसलिए कोरोना मुक्त होने के लिए भगवान की प्रार्थना करने के लिए उधर गया था।
And now, at a time like this, we're looking at, of course, bed shortages, ICU beds particularly, a serious shortage in Karnataka. At a time like this, the Karnataka State Road Transport Corporation have now made a few buses. They've turned a few buses around into makeshift ICUs. Nagarjun Dwarkanath brings us this report. Let's take a look.
As Bengaluru is facing shortage in ICU beds, the Karnataka government has made a bus into... As there's a shortage of ICU beds in Bengaluru, the Karnataka government, with incorporation of the state bus transport, has made makeshift ICU beds by converting buses right now into ICU beds because there's also a shortage. Remember, Karnataka government is making 4,000 ICU beds immediately available in Bengaluru because there is shortage. The government has also named an IPS officer to coordinate with this. Now, this bus has 5 such ICU beds with the medical facility also. As you can see, state-of-the-art technology has been used and converted this Karnataka Sarige bus from KSRTC Corporation into ICU beds. Services
Sir, oxygen and body oxygen level ನೋಡ್ಬಿಟ್ಟು oxygen beds 5 ಮಾಡಿದ್ದಾರೆ. ಅದರಲ್ಲಿ ECG facility ಇದೆ, temperature ಇದೆ.
So what she said was there are 5 such beds including oxygen facilities, and also what they have is ECG to check the pulse rate, to check the performance of the heart as well. So it's completely equipped here. As you can see, if this was a normal bus, where I'm standing would have seats where passengers would be standing and sitting, but now it's completely modified into a makeshift bus for COVID patients here in Bengaluru, as Bengaluru still has shortage of beds both in government and private hospital sector for COVID patients. Nagarjun Dwarkanath for India Today.
And now shifting focus to Kerala, where we see that the new government, the left government, has come back to power. There's a lot of talk about KK Shailaja, who was the health minister of Kerala. She is not going to be re-inducted to the cabinet. Pinarayi Vijayan and his government has now taken a decision that none of the faces or none of those who held a cabinet post previously will be taken into the cabinet this time. They're going to allow fresh faces to come forward and take charge. In the meanwhile, there's a fresh plea that's also filed in the Kerala High Court against this massive oath-taking ceremony that will take place in no time from now, which will have about 500 people amid the pandemic. Let's take a look at the roundup of this news.
From Nipah virus to COVID-19. Kerala has been hailed by the world for its handling of health sector. And much of the credit goes to KK Shailaja, also known as Shailaja Teacher. The health minister of the state who hit the global headlines, the familiar, reassuring face of Shailaja will be missing when Pinarayi Vijayan and his new team takes oath on Thursday. Vijayan, who won a historic re-election on the plank of his government's handling of COVID and welfare measures, dropped the entire cabinet, opting for an overhaul. Shailaja, who won the biggest margin in the Kerala elections, says she has no grudge.
It is a policy decision that no one should continue to the next cabinet, and all the ministers were not there, and it is a very good decision, and it's a chance for the fresh comers, and they are coming, and I appreciate it, and I welcome the newcomers.
Her exclusion from the cabinet drew sharp reactions on social media, even from the rivals like Congress MP Shashi Tharoor. In the new regime, Shelja will be the party whip, pretty much an insignificant post. Political pundits are now drawing comparison between Shelja and K.R. Gauri, who recently passed away. Gauri had incidentally been denied the CM post by the CPM years ago. But unlike Gauri, Shelja is unlikely to raise any murmur over her exclusion. Bureau Report, India Today.
We're looking at black fungus cases on the rise across India. And at a time like this, when patients are rushing to hospitals to get treated, it appears that the very important antifungal drug amphotericin, that is amphotericin B, that is used to treat black fungus, is in serious shortage right now. There is a shortage of supplies. Most of the hospitals are trying hard to procure it. In fact, tenders have also been floated, but it seems like the shortage is only now worsening the woes of the medical fraternity and, of course, the patients who are waiting for it. Many of them have even succumbed before receiving the shot.
A dangerous rash, a rash that disfigures faces, can maim or even kill people. India is reporting rising incidence of mucormycosis or black fungus infection among COVID patients. A consequence of steroids that reduce immunity and increase blood sugar levels in critical coronavirus cases, more so in chronic diabetes.
डायबिटीज़ जिसको भी है वो अपना कंट्रोल में रखे, वो वैसे भी अच्छा है, कोविड या नॉन कोविड। अगर हम इरेशनल यूज़ ऑफ स्टेरॉइड्स करते हैं, टाइम से पहले देते हैं, टाइम से ज़्यादा देते हैं, फालतू में देते हैं, डोज ज़्यादा देते हैं, तो ये समस्या खड़ी हो सकती है, होती है।
And the drug that treats this potentially fatal infection has flown off the shelves. The injection is out of stock in various medical stores across Uttar Pradesh. No active data of black fungus is available from the state, but pharmacies are reporting a spike in demand for the drug.
अब दवा एक ऐसी चीज है कि ये दवा की इतनी सेल ही नहीं थी, उससे 100 टाइम इसकी सेल एकदम से बढ़ी, तो अब कंपनियों से रिक्वेस्ट की गई कि इसको जल्दी से जल्दी।
In the meantime, the state government has formed a 12-member team to deal with the black fungus challenge and normalize drug supplies. This man in Madhya Pradesh has been looking for the antifungal injection for his mother since May 13, but without success.
मुझे डॉक्टर ने बोला है कि आपको कम से कम 20 से 30 इंजेक्शन लगेंगे और इंजेक्शन की कीमत भी 8,000 रुपये है, कोई कम कीमत नहीं है। तो उसको ढूंढते ढूंढते सर मैं तो परेशान हो गया हूँ। अब उसकी कोई समझ में नहीं आ रहा कि क्या करें, मिल ही नहीं रहा है। पूरे भोपाल में ढूंढ लिया, इंदौर में तक पता कर लिया, ग्वालियर में पता कर लिया, पर कोई अवेलेबिलिटी के बारे में कोई जानकारी ही नहीं मिल रही है इसकी।
Faced with shortages, the state government has sought 24,000 doses from the centre and sourced 2,000 from the drug makers. In India, Bharat Serums and Vaccine, Wockhardt, Abbott Healthcare, United Biotech and Cipla are the major manufacturers of amphotericin B, which costs between 4,500 and 12,000 per injection. The centre has supplied 1 lakh vials to states to jack up supplies. Imports are also being explored. Maharashtra has floated tenders for 1 lakh injections. And Gujarat is reaching out to private companies to meet demands.
ऑनरेबल प्राइम मिनिस्टर ने देश के उन डॉक्टरों से जो कि इंटीरियर एरियाज में, रूरल एरियाज में और 2 टियर और 3 टियर टाउन्स में काम कर रहे हैं, बोथ कोविड और नॉन कोविड सर्विसेज प्रोवाइड कर रहे हैं, उनसे भी इंटरेक्शन किया। उनसे रिक्वेस्ट भी की है कि म्यूकरमाइकोसिस जो कि एक नई समस्या के रूप में उभर कर आ रहा है, उसके बारे में अवेयरनेस स्प्रेड करें, पर्टिकुलरली 2 टियर एंड 3 टियर टाउन्स में भी।
For now, though, shortages persist, even in the national capital.
We are looking for a reality check at the RML hospital medicine shops that are these medicines available or not. We are talking to a few of the medicine shop owners. आपके पास क्या है एम्फोटेरिसिन बी का क्या सिचुएशन है?
एक ही शॉप है, सिंगल है, नहीं है, सब बताया आपको, एक हफ्ते से नहीं आ रही।
So what they are telling that these medicines, which are in fact antifungal medicines and are very important in the context of the black fungal disease. These medicines are now out of stock.
The financial capital in Maharashtra is also impacted by black fungus and shortfalls of amphotericin B.
मेडिकल केयर सप्लायर्स जो हैं उनको कंपनियां चूंकि पहले इतना ज़्यादा डिमांड नहीं था तो उतनी मैन्युफैक्चरिंग हो नहीं रही थी. अभी इस इंजेक्शन का ऑल ऑफ सडन लगभग सभी हॉस्पिटल्स में, आईसीयू हॉस्पिटल्स में इसका डिमांड है और उनके रिक्वायरमेंट डिस्ट्रीब्यूटर्स को आ रहे हैं, जिसके हिसाब से पहले मैन्युफैक्चरिंग है नहीं, इसके लिए अभी वो गुड्स मार्केट में शॉर्ट हो गया है.
An infection that has added to the woes of recovering coronavirus patients.
When asked, the top experts of the government have said that they don't have a full-scale data on the number of cases of black fungus being reported in the country. But they did say that it's not an outbreak yet, although the number of cases are large. But states have already pressed the panic button to say that there's a shortage of the drug that treats black fungus, which is also leading to mortality in many cases across the country. Milan Sharma for India Today.
Now, cutting across to Hyderabad, we've seen people irresponsible out on the streets violating COVID guidelines. Here's a glimpse into Sultan Bazaar, Hyderabad, where people right in the morning, around the time when there are some relaxations for people to come out and buy groceries, this is the time people came out in large numbers, gathered around the Sultan Bazaar market in Hyderabad without following COVID norms, not wearing masks, many of them not wearing their masks and throwing all protocols to the wind. Absolutely unfortunate. We're looking at a pandemic which is raging at a time like this. We see COVIDiots on the prowl.
The problem is all the market is at one place only and it is getting overcrowded. And within that small time period, it is very difficult for us to do the shopping. So I have to come into the market and the clusters. These are the problems which we are facing.